So good evening, ladies and gentlemen. Thank you for Rethink for inviting me to speak today, and thank you to all the organizers. This has been an amazing evening, and since I'm the last speaker, I just have to say that it's difficult to give a presentation after such a moving and powerful movie. So, breast reconstruction, where we are now. I'll begin my presentation by answering the most frequently asked question that I get, which is how common is breast reconstruction use following mastectomy? Well, we know that in the United States, approximately 40% of women undergo reconstruction following mastectomy. While this statistic varies greatly in Canada, depending on the province you live in. In Ontario, we're the lucky ones. About 30% of women will undergo breast reconstruction following mastectomy, while this statistic is much lower in the maritime provinces and elsewhere. So on this graph, you can see that these are the results of a study that we performed right here in Ontario with funding from the Canadian Breast Cancer Foundation. Well, we know that the use of breast reconstruction at the same time as mastectomy has been on the rise in Ontario. Since 2006, breast reconstruction has increased by 44%. So why this increase? Well, the shift in paradigm was set into motion long before the much publicized surgery from Angelina Jolie. I think that the increase in breast reconstruction is attributed to all four of these factors, which I will talk about in more detail now. First of all, women's attitudes towards breast reconstruction are changing. Today's women are much more likely to undergo and want to undergo breast reconstruction than live with their mastectomy sites. My patients tell me, I had reconstruction not out of vanity, it's just a matter of being able to wear what I want to wear and feel comfortable with what I'm wearing. I could never wear a bathing suit or that sort of thing. Most of my clothing was just off limits. Or this type of statement, I have 2 little girls. I'd like to be able to have a female shape again after surgery because obviously I'm gonna want my daughters to grow up and have healthy and positive body images of being a woman. Secondly, our patients today who are undergoing mastectomy and breast reconstruction are younger, and this probably speaks directly to the availability of genetic testing, as well as the effectiveness of prophylactic mastectomy at eradicating future development of breast cancer. So this is a 35-year-old patient of mine who allowed me to use her photo. She was diagnosed with BRCA1 gene positivity. She comes to see me because after much debate, she's now committed to undergoing bilateral prophylactic mastectomy with reconstruction at the same time. So this is her after surgery, after we performed bilateral nipple-sparing mastectomy, and at the same time, we reconstructed her with silicone implants. So this is, again, her after surgery. Other than the scars on her chest, which will fade a great deal over time, it's difficult for anyone other than her to know that her breast tissues have been completely removed and completely artificially reconstructed using implants. At my home institution, which is Princess Margaret Hospital, as well as most American centers, nipple-sparing mastectomy with reconstruction at the same time has become our preferred surgical technique for most gene carriers who do not actively have breast cancer. From a cancer perspective, we believe that nipple-sparing mastectomy is safe. And more importantly, we also know, because our patients tell us, that nipple-sparing mastectomy, while we preserve their nipple, give them the most natural and aesthetic shape. The third driving force behind increased breast reconstruction is that today's breast implants are safer and higher quality. Out are the older generation silicone implants that used to cause this amorphous, unnatural shape. The older implants caused a great deal of scarring around the implant. Today's implants that we use are highly cohesive, anatomically shaped implants, what most patients know as gummy bear implants. Well, they produce a very natural aesthetic look as well as feel. And fourthly, we now have more sophisticated surgical techniques of using the patient's own existing tissues to build a breast mound. So now we can remove tissue from the patient's abdomen just using skin and fat without violating or injuring their abdominal muscles. We can transfer this tissue up to the chest, hook up tiny blood vessels under the microscope, and build a very natural-looking breast mound. And this procedure also has a dual benefit of giving the patients improved abdominal contour that most patients appreciate. So I'll just show you one clinical example. This is a 43-year-old patient of mine who was diagnosed with left breast cancer. She was treated with mastectomy, chemotherapy, and radiation. So this is her before surgery. This picture on her right is after undergoing left breast reconstruction, only using her abdominal skin and fat. And we also did nipple areolar reconstruction, and we gave her a breast lift on the other side to balance. So in closing, not every patient will want breast reconstruction or is a candidate for breast reconstruction. However, my patients who have undergone this type of surgery have told me that the benefits, both emotional and physical, can be life-altering. Thank you.